Okay, welcome to the March seminar, everyone. We have Viola Angelini from University of Groningen, who's going to present the extending employer responsibility for sick listed people, or basically employees on sick leave. Viola, 1 hour, basically 45 minutes of talk, hopefully, and then if there are any, I hope you're okay to answer any questions during the seminar. Everyone, please keep your microphones on mute unless you have a question. Then, of course, unmute and ask your question. So, with that, over to you, Viola.
Thank you so much. I'm very happy to be able to present this paper. So, thank you so much for the invitation to present in this seminar. And yes, of course, I'm very happy to get questions along the way. Yeah, please interrupt me whenever you like. I mean, I also kept the presentation a little bit contained so that there is a little bit more room for discussion. So first of all, this is a joint work with a number of co-authors from Groningen, Laura Jansen, who's a PhD student at our faculty, and then Max Groneck, also at the Faculty of Economics and Business in Groningen, and Raun van Ooijen, who's now at the medical center, but an economist also by training. So in this paper, we want to look at the effect of the responsibility of the employer on reintegration efforts, essentially, of sick employees. So first of all, like what is our motivation? So as you all know, I don't need to spend a lot of words on this, but population is aging, and government are responding to this aging of the population by doing reforms of their welfare systems and their pension systems. And one of typical reform that many countries are implementing is, for example, increasing the retirement age to respond also to the increase in the life expectancy and the aging of the population. But actually, this increase in the retirement age also increases the risk of not being able to work over the full working life for many individuals, for example, because of health conditions. And actually, this makes it also more likely to have disability within the workforce. And what we see in the data, at least this is for different European countries, is that the employment rate of disabled workers is typically 25 percentage points lower than the employment rate of non-disabled workers. And the public spending on sickness and disability is already pretty high because it corresponds to around 2% of GDP in European countries. However, having a disability, does not automatically imply that you are not able to work. And there is actually a lot that employers can do to alleviate the impact of disability and making sure that the workplace is inclusive, and also people with health conditions can participate in the workforce. And they can do that, for example, by providing accommodation. So what is accommodation? So, well, accommodation is very broad, and a very general definition is that accommodation is basically any change in the work environment, or actually in the way a job is performed. So this has to do with task rather than the environment itself, that enables a person with a disability to enjoy equal employment opportunities. So there is quite a lot indeed that the employer can do, and examples of this work accommodation are, for example, allowing for more breaks, or actually changing the physical workplace, making adaptations. But it could also involve changing, the type of tasks that the employee has to perform, or provide coaching or training on the job. And actually, this is what this project we're working on is part also of a bigger project for which we got funding from DESPAR, which is a Dutch kind of think tank, is in which we really look at what is the role of the employer in helping the employee to go back to work. And so there is already a lot of evidence, also scientific evidence, that this work accommodation, so as I said, physical accommodation, but also changing the task, and so actually is very helpful because it improves the return to work. It can also delay a disability insurance application and can increase employment of people who have health conditions that prevent them from working. So this is, there are many papers on this, and this is something we know. However, of course, it is also costly because, implies that the employers really has to put effort in the integration of the employee by providing all this kind of adjustment to the workplace or, to the type of work and type of tasks of the employee. So actually in the Netherlands, the Netherlands is quite unique in actually giving quite a lot of responsibility to the employer in providing accommodation and actually improving the chance that the employee continues to work. And in particular, there is a policy that really incentivizes firms to accommodate, which is experience rating, what we call experience rating, which is both in sick leave and the I premiums, because these premiums that the employers have to pay, insurance premiums that the employment have to pay, actually depend on sick leave and the I cost. So in other words, basically, experience rating encourages firms to internalize costs, because if the firm has a higher, say, has a higher percentage of people on sick leave, but also later on who go into disability, they will then have to pay higher insurance premium for DI. And so by doing this, you create really a financial incentive for the employer to make sure that their employees return to work and they don't go into disability. Now, this is it's in the Netherlands like that, and it is also in another country that has experience rating is Finland. So these are quite two, let's say, exception around. So actually, this experience rating indeed encourages firms to internalize the cost, and there is some evidence that this experience rating reduces indeed the sick leave and also reduces inflow into disability benefits. Although the evidence is a little bit mixed, because for the Netherlands, some studies find yes an effect, some studies do not find an effect. Well, the same also for Finland. So there is some, the evidence is a little bit mixed. But most importantly, none of these studies, as far as we know, really looks at the direct effect on accommodation efforts of employers. So they really look directly at the effect on like the sick leave and the inflow in disability insurance, but they don't really look at the effect on workplace accommodation. So in this, basically, this is what we try to do in this paper. So our main objective is that we want to estimate the effect of this experience rating on employer accommodation, so on whether employers really accommodate their employees who are sick. And we do so by leveraging a Dutch policy reform that I will explain in a minute, slowly, because it's quite complicated. A Dutch policy reform from 2013 that actually introduced exogenous variation in experience rating, and so this exogenous variation that we are going to exploit. And now, of course, I will explain it in a moment in detail, this reform, but in a nutshell, this reform extended experience rating also to non-permanent employees because before it was only apply only to permanent employees, and now it extended experience rating also to non-permanent employees, and also tied its level to the size of the firm. So it changes, by that it changes the way experience rating works. And we will use actually quite unique survey data, and the survey data are collect also information, are survey data on employees, and they collect information on workplace accommodation, but they collect information for workplace accommodation for long-term sick listed employees. And so this is important to stress. I will come back to this also a little bit later, but it is important to stress that in our data, and this is somewhat also partly, so it's interesting, but it's also partly limitation, is that we have the data consists of long-term sick listed employees. So these are employees who have been on sick leave for at least 9 months. Okay, so it's quite it's a long-term sick listed employee. So they have been already on sick leave for at least 9 months, and then they are asked about. They are sent a survey, which we are asked a lot of information. We know quite a lot, about their characteristics. We know about the accommodation, the type of health conditions that they have, and we also have we have information on the firm, on basically on the employer side. So the contribution. So I think the contribution is of this paper is threefold, I would say. So the first contribution is that most of the literature that looks at the experience rating. There are several studies, and the studies focus typically on the Netherlands and on Finland, because as I explained before, the Netherlands and Finland are the two countries that have fixed experience rating in disability insurance. But these studies typically focus on the effect of experience rating directly on sick leave or inflow or outflow in disability insurance, but they don't look at basically the kind of intermediate step, which is actually because the way in which experience rating is supposed to work, so is through increasing the incentive of employer to provide accommodation. So the whole idea behind the introduction of experience rating is the experience rating should reduce, should shorten sick leave and should lower inflow in DI, because employers internalize the cost of this, and therefore they have a financial incentive to improve reintegration efforts and by providing accommodation to employees.
Viola,
Yes,
if I
yes,
just may ask you some question
course.
of understanding, being not in health economics so deeply involved. What kind of sickness is this? To be longer than 9 months, but not permanently sick, not handicapped or whatever. Yes, it's not. If I am just coughing or whatever, have a headache today, that's not the problem. I cannot leave for 9 months. What kind of sickness is this?
No, so first of all, yeah, thank you for the question. I will show you the data a little bit later. But no, but I can already answer, of course, this question partly. So first of all, this is a sick leave. So you can also be partly on sick leave. So for example, you only work at 20%. So you have some sick leave. But the vast majority of this is either actually mental problems, for example, burnout, say, or and there is also a lot of musculoskeletal problems. So like, I don't know, very heavy injuries, or like a backaches or so. As you can imagine, of course, this is a little bit difficult, because of course, in typically in the literature, you always find that the vast majority of problems are mental problems and musculoskeletal problems. But of course, it's a little bit tricky, because these are also the conditions that are less easy to precisely identify, for the
Okay.
from the doctor,
Okay, thanks.
Yeah.
So while I have just a short question.
Yeah, of course.
So when you're looking at the sample, is it public sector? Is it only private sector, or they could be in the public sector, these workers?
We are anything. Yeah. So we are just workers. So this was sent by these workers. So this kind of survey was sent to all, because there is some kind of national institute, you know, and this was sent to all kind of employees. So we are in different sectors. So we will control for the sectors. Yeah.
Okay, good. Thank you.
Yeah. So it just from in principle, it was sent to the entire population of long-term sick listed workers. But of course, not all of them responded, but it was sent to all of them, independent of the sector. So it's not specific to one sector, it's at the national level.
Okay, good. Thank you.
So, first of all, so we look at really the direct effect on providing accommodation. This is one. Two, we actually also differently from the previous. So most of the literature just focuses on permanent employees. Yeah. But we also have data on non-permanent employees. So these are typically either agency workers or workers with a temporary contract. And I think this is interesting because typically this is a particularly vulnerable group. And third, because we have this data on accommodation, I think we can also look at the determinants of accommodation. So that do all workers have the same chance of receiving actually accommodation, so being helped to be reintegrated? And you will see that we find also quite some striking differences there, showing that this is actually not the case, right? So not all employees have the same chance of receiving accommodation from their employer. So, and that more descriptively. So first of all, let me explain to you a little bit how sick leave and disability insurance in the Netherlands work. It's quite complicated, so I try to make it somewhat clear. But so first of all, employees who become sick, so this is the question before, like who are the sick listed worker, this is what we mean. So employees who become sick are actually entitled to at least 70% of their gross wage for up to 2 years after becoming registering as sick. So this is quite a long period, so it's 2 years. And after this period of 2 years, they can apply for disability insurance benefits. Now, in these 2 years of sick leave, employers pay for the sick leave of their employees, and they pay for the disability insurance premium. Now, what happens, it depends a little bit on the type of employees. So we have 2 types of employees. We have permanent employees and we have non-permanent employees. So for permanent employees, so there is no public insurance available for the firm, but the firms can, of course, self-insure, or they can purchase private insurance to be able to pay, the sick leave. But for non-permanent employees, so non-permanent employees are typically, as I said, agency workers or workers with temporary contracts. Employers can use public sick leave. Now, when they use public sick leave, basically, then it's up to the public. They have public insurance, and so as the public insurance will take the task of paying the sick leave benefits, but also will take the task of putting the effort in reintegrating the employees. But they can also decide to opt out of the public sick leave insurance if they can self-insure, for example. And then if they do so, they take full responsibility of both the payments of the benefits, but also of their integration efforts. Now, after 2 years, so if after 2 years the employee is not yet fully 100% back at work, the employee can apply for disability insurance benefits. Now, this is assessed, of course, by a physician. So there is an external assessment, and there are three possible outcomes. It could be that the person is not eligible for disability insurance. The employee is eligible for full disability insurance, or the employee could be eligible for partial disability insurance. So, and here, again, while fully disability insurance there is a full public insurance only, and this is also will not be affected by the reform, so we will not be looking at it. Actually, for partial disability insurance, there is public insurance for both permanent and non-permanent employees, but for permanent employees, it is possible to opt out. So not for the permanent employees themselves, but for the employer can opt out of the public insurance, and again decide to self-insure. So these are basically how it works. So it's very long. It's for 2 years. So there is already quite a lot of responsibility of the employer, because for 2 years the employee can be sick for up to 2 years, and in these 2 years the employer is in principle responsible for the sick leave, and whether there is insurance or not depends on public insurance or private insurance, depend on the type of employee. Now, in 2013, 2024, there was a reform in the Netherlands. Well, in Dutch it's called BZA, but basically what this stands for is called the Modernization Act of Sick Leave Benefits. But not, the name maybe is not so interesting, but yeah, there was this reform of the disability insurance system, and this had basically two goals. The first one was to align the financial incentive for permanent and non-permanent employees, because essentially I discussed before experience rating. So experience rating means that the premiums paid by the firm are depend on are experience rated, so it depends on how much sick leave and how much disability inflow there has been for that employer. But before the reform, experience rating sick leave benefits and partial DI premiums was only for permanent employees, and after the reform, experience rating was extended also to non-permanent employees, so provided more incentive to provide accommodation also to non-permanent employees in principle. And the second goal, so now the incentives are aligned for both groups. And the second goal was, was to link experience rating to the size of the firm. So the experience rating is not, the extent of the experience rating depends on the size of the firm. And how does it depend on the size of the firm? It's basically, as you can imagine, so in a sense, small firms now are more protected than large firms, because for small firms, you can imagine that, this can have, if you have some employees on sick leave, this can have, can be financially quite intense. Basically, experience rating implies that there is some kind of individual risk of the firm, and this individual risk is basically computed as what is the sick leave or disability insurance risk of that specific firm compared to the average disability risk in other firms. In the sector essentially. So if in your firm there is more sick leave and more disability inflow, but in other firms then signals like a higher individual risk. Now, this is different. Now they introduce the experience rating, they make it dependent on the firm size. So for small firms, essentially after the reforms, there is no experience rating, so everybody just pays whatever is the sector premium. So experience rate there doesn't play a role. For large firms, it's the opposite. So for large firm, it's like large firm is more than approximately more than 100 employees. The individual premium is really the individual risk. So for large firm, really the higher the risk, so the higher, say, sick leave and the higher disability inflow they have at their firm, really the higher premium that they have to pay. And for medium-sized firm, it's some kind of weighted average between the sector premium and the individual premium. So this was not the case before the reform. Before the reform, the firm size did not matter, and after the reform, they made it dependent on the firm size. And basically, well, the idea of experience rating, as I said it already, but say again, is that this provides an incentive to accommodate, to prevent inflow in disability insurance, or to make employees return earlier, because you want to basically lower your individual risk so that you have to pay lower premium. So this is a general idea. So now these reforms give us create some groups, so that you can look at them in different ways. So because now there are two things happening. So one is that this experience rating is also extended to non-permanent employees. That's one. And the other one is that now this experience rating depends on the size of the firm. So, for example, small firms do not have experience rating at all, and large firms have full experience rating. So this creates different groups. So for some, actually, experience rating is introduced after the reform, and for some, experience rating is removed after the reform. So, for example, when we look at non-permanent employees, then for non-permanent employees now there was no experience rating before, and now there is experience rating, but there is experience rating only if you are only for employers, like only for firms which are medium and large size, while there is still no experience rating for small firms. So those are our kind of control group. And on the other hand, we also have cases of where experience rating is not there anymore, because for permanent employees before the reform, experience rating was just for everybody, dependent on the firm size. And now, after the reform, there is experience rating only for, so before it was for everybody, and now it is only for the large firm. So this creates several different treatment and control group that we can analyze. We can look both by using non-permanent employees. We can look at the effect of the introduction of the experience rating, and by looking at the permanent employees, we can look at the the removal of experience rating. So we can look at both and see what happens. So now the data. So the data are from, in Dutch it's called weg naar de via. So this is the pathway to disability insurance. And we use 3 surveys. So we have 3 waves. So from 2008, 2012, 2015. And remember, this reform was in 2013, 2014. So in total, these surveys were in principle was sent to the universe of long-term sick listed employees. But we have responses for about, I think, 1/3 of them. So we have, 45%, I think, was the response rate. So we have 12,524 respondents. They can be permanent or non-permanent employees. They are all between the ages of 18 and 67. So, 67 is the retirement age. And as I said before, this is important to the story that, or not to the story, but it's important also to the interpretation of the results, because we need to see what we make out of them. We have only employees who have been sick already for at least 9 months. So we don't have the very short term sick employee, and this is important because, of course, it could be that it is different, maybe, you know, for this long term sick employee than for the shorter term. Now, so we look at we have information on accommodation, and so there is a question. So, what did your employer do since you became sick? And, you know, there are several possibilities. So you can be that, as I said, there are different ways in which you can be accommodated. For the moment, we just use a binary accommodation, so whether you're accommodated or not. And so, and there are several possibilities. So you can be that you got different or fewer tasks, or different or fewer hours of work, that you work on a therapeutic basis. Workplace, or there was some adjustment to your workplace or equipment, that can be other type, or it can be nothing. And we also have a question about satisfaction with accommodation, but this is just a binary variable. So, and then so it's not like on a scale, but it's just a binary. Did the employer, so it's asked to the employee, did the employer do enough to accommodate you? Yes or no. So it's very simple. Just satisfied, are you satisfied or not with the accommodation? Is not very detailed. So we have information on the firm size, and we know the year, of course. And we have a lot of information, actually. So the data set is quite interesting in general, because we know the type of contract, we know gender, education, we know migration background, age. We also know the type of disability. So what you were asking before about the type of illness, we have information on firm size, we have information on the sector of the firm. So this is very rich data. So the first thing that maybe just you want to see is simple descriptive statistics on our data. And also when you look, for example, it's immediately apparent when you look at the descriptive statistics. So there are some things that are quite striking. For example, permanent employees, and this is also how you can imagine, permanent employees are much more likely to be accommodated than non-permanent employees. So like 79.2% against 29%. And they are also much more, on average, much more likely to be satisfied with the accommodation effort. This is conditional on being accommodated, right? So conditional on being accommodated, 80% are satisfied compared to 58% of non-permanent employees. There are also other differences. For example, migration background. People with a migration background are less likely to be accommodated, and older employees are also less likely to be accommodated than younger employees. So this is what you can see, and the same holds for high education level. So for all kind of groups, in general, permanent employees are more likely to be accommodated than non-permanent employees, at least from a descriptive point of view. And we have differences by migration background or by education level as well. So disability type. So we have actually there are several options now. We categorize them here in 4 groups, so say. But notice that multiple types are possible, so these are not mutually exclusive. So you could have several, of course, you could have several conditions at the same time. But the vast majority is musculoskeletal condition, and psychological problems are like really the most frequent here of all. And then there is some role for heart and vascular problems. So we have a very fine distinction, but I'm just showing you this. And now we know something about the firm size, and we also have the firm sector. So the question I had before, you see, is not only the public sector, but we have industry, transport, trade, services, public. So we have all type of sectors. So this is really the universe of employees who are sick listed. Okay, so like for the methods, so because we exploit with so we are going to do two things actually. So let me first say that I already showed you the descriptive statistics on accommodation, but we are also going to do that in a regression setting. So we are going to see what are the determinants of accommodation. This is simply descriptive, but nonetheless I find it quite interesting to see who are the employees who are accommodated, who are not accommodated, and does everybody have equal chances to be accommodated? I think from a policy perspective, it's descriptive, but it's relevant. And second, we are going to use kind of the difference in different setting in which in which our dependent variable is the accommodation effort. And as I said before, for non-permanent employees, we can use the group of non-permanent employees to look at the effect of the introduction of experience rating in sick leave and partial disability insurance benefit. And we can use, because this was introduced because it's the largest, it should be large, medium, and small should be small, medium. But okay, so this was introduced for non-permanent employees, and we can use the group of permanent employees to look at the removal of experience rating, because for those for employers with permanent employees in small firms, actually experience rating was removed after the reform. So we can use these two groups to look introduction and removal of experience rating, which is interesting. Now, first of all, just when we look at this, is extremely descriptive, just a simple kind of pooled OLS regression. But just to look at the determinants of accommodation, well, what we find is kind of in line of what we saw in the descriptive statistics. And so what we see, so we distinguish between non-permanent and permanent employees, because as you've seen, they are quite different. But you see, you have patterns that you might expect. So in general, especially for permanent employees, older employees are much less likely to be accommodated. So much less effort is put in reintegrating older employees rather than younger employees. Now, also, there seems to be less accommodation effort for individuals with heart and vascular problems. Now, I don't have a very super good explanation for that. It might depend on the type of task and so. And employees working in services are less likely to be accommodated. Again, sometimes all these things also, like the result for education might actually reflect maybe the type of work that these people are doing. And employees in large firms are more likely to be accommodated than employees in small firms. So again, important, so not everybody, also when we look not at the descriptive statistics, but also like in a more kind of regression type of settings, we do observe this difference, and we find that we think that this is actually interesting to see. Okay, so then of course we do some tests because it's a definitive to look at the parallel trends, but maybe let me show you the results. So actually what we find, so the first two columns are for the non-permanent employees, where we look at the introduction of experience rating, and the other two columns are for permanent employees, where we look at the removal of experience rating. And actually what you see here is that we do not find, actually, both when we look at introduction of experience rating, and when we look at removal of experience rating, so we do not find any, especially when we look at the treatment, so the after times the large medium and the after times small medium for the two groups, we do not really find a significant effect. Of course, when you look at the coefficients per se, so when you look at non-permanent employees and after the reform for large medium, the effect is 0.06, so this is the coefficient is 0.06, so this is actually quite a large effect, but it's very imprecisely estimated. So I think it's difficult to say whether it is like, okay, there is an effect, but we do not have enough power to detect, or there is no effect. So, but of course, I mean, we think that there might be, so we do not find any effect of this experience rating. So we think that maybe it is because we have these long-term sick listed workers. So it could be that we would find an effect if we would have data, but we don't. If we would have data on like a short-term sick listed worker, we would find an effect there. But because we look at the workers who have been on sick leave for at least 9 months, maybe accommodation efforts there are less because, well, employers simply do not expect an improvement anymore because the period they have been sick for already so long. Although remember it's already 9 months, but I mean they have, so they can stay on sick leave for 2 years. So I mean there is still quite some horizon in which they, in principle, they would be able to go back to work. Or maybe there is some lack of awareness of how the experience rating works from the firm side. That's difficult to say. Now we also look at something else. Here the evidence is a little bit suggestive, but we find it, we think it might be interesting. So now I know that this was a lot in terms of reform, but so let me recall you something. So remember that for non-permanent employees, it is the employers can also kind of opt out of this public insurance system. So then they just opt out and they just self-arrange the sick leave benefits and also the reintegration of these non-permanent employees. So then they opt out of this. Because actually this experience rating, in a sense, causes a kind of misalignment between the party which is responsible for integration and the party whose premiums depend on integration quality. Because if there is a public insurance, then in principle is this employee insurance agency that is responsible for the integration. But then if sick leave or disability inflow is very high, then the ones who's going to pay the consequence for it is the employer, because the premiums depends on their integration quality, and so this causes some kind of misalignment of incentives. And so we try to look at, so at least a bit it's a bit explorative, this analysis, but we want to see, okay, do these firms opt out of public insurance when experience rating is introduced? No, so it could be that now that there is experience rating, then the firms just opt out of public insurance so that they don't have to pay this experience rating. They prefer to kind of self-arrange the sick leave benefits and the reintegration rather than going through this public insurance when with experience rating. And so actually we look at that, with a similar idea. We also have information on whether the employer opt out of his public insurance to kind of self-insure and take care directly of this, so that then there's no experience rating anymore. And we do find, so if you look at here, we do it in a similar fashion. So we do find a significant positive effect of the reforms on the number of firms opting out. And actually, we also find, that those who, well, it's a bit tentative, but we try to look at, we also find that those who opt out actually also increase their accommodation effort. Now that they have to self-insure, so they have to completely pay themselves, includes that. So of course, this is a point of attention also to look at. This is a kind of unintended effect of the reforms, I would say, that could create some kind of lemons problem, because maybe only the firms with really bad risk stay in the public insurance system, and the others actually opt out of the public insurance system and decide to self-insure. But so we find this, but actually, so as I said, this is a little bit, tentative, because the effect of experience rating on accommodation remains significant. Even when we also try to look, okay, what happens, the effect of experience rating if we exclude the firms that opt out, but this still remains quite not significant. But so there is, I think, bottom line is there seems to be some kind of unintended effect of the reform, that our firms, because there is experience rating, they just opt out of this public insurance system. And this can create, of course, some kind of lemons problem. So we do, as often, large number of robustness checks, so I don't need to go one by one, but we try to look at, for example, as I said, non-permanent employees, there are two types. There are the agency workers and the workers with temporary contract. And now maybe these are, they are both non-temporary employees, but they are quite different between each other. So we try to see what happens when we split the sample. We also remove people who move to a different employer, because of course in the sample, you can also be that in the meantime you move to a different employer, or there are also quite some individuals that then become, so these are all employees and now we decide to become self-employed. We also don't find any difference. We also, there are all kind of complications, because some people change type of contracts during the 9 months, maybe they suddenly get a permanent contract.
Sorry, Viola, just for 5 minutes, sir.
Yeah. Thanks. I'm there, I think. So we do a lot of so without describing them by one, but we do a lot of robustness checks in which we look at different groups, what happens if we exclude, because now I made a quite simple distinction between, like these permanent and non-permanent employees, but things happen, as you can imagine. People who change contracts, people who become self-employed, and etc. So now, basically, to conclude, so we in this paper we try to see whether this experience rating has as an effect on employer accommodation, because all kind of papers that look at the effect experience rating directly on kind of sick leave. But in principle, the idea was that this would go through accommodation. So we look at that. We do not find the coefficient is not small, but is not significant. So yeah, it's difficult to draw strong conclusions. So it could be that this is due to our sample, but we cannot exclude that actually experience rating works in the right direction for short-term sick listed workers. So maybe it's because this has been sick for a very long time that there is no people think that there's no way that they can kind of go back to work. Then in that case, you should think though at the duration maybe of this sick leave. So I think it would be further research would be interesting in looking at these short-term sick listed workers. It could also be firm awareness. Maybe the firm is not aware of all these consequences, because as you have seen, this is quite a complicated system, and maybe the financial incentives are not always clear. We also find, that there is an increase in the numbers of firms who opt out of public sick leave insurance for non-permanent employees. So I think this is important because it's a kind of an unintended effect of the reform. And I think that the policymakers should have this in mind, because we create a potential for a lemons problem. Because if you can opt out, then maybe only the kind of the good firms, like with not a lot of sick leave, opt out of the system. and only the bad firms stay in. And finally, although this is a bit descriptive, as said, but it's rare also to have this data on accommodation and on the type of accommodation. We also find important that not every worker has the same chance of being accommodated. If you see, for example, permanent employees, but especially highly educated people and younger people have a much higher chance to be accommodated. And so we think that actually ensuring equitable access to accommodation should remain a priority. And this is especially important, even more important in this context of an aging society, where you can expect that more and more people might not be able to kind of work throughout their full working lives. And that was my conclusion. So I stay within the 5 minutes, I hope.
Great. Thanks very much, Ella. I just want to say I'm going to leave in about 2 minutes, but Klaus is here to kind of see through the whole thing. So Fanny, you're up, it seems.
Yes, a quick question. So in terms of the union membership, because my understanding is when I'm looking at your permanent workers, is it possible that most of them are relatively unionized jobs? Because when I was looking at any of your controls you included, I don't know whether you control for anything to do with the union membership, or you know what I mean? Because it could be something else going on there. You know what I mean? Because in terms of, I would suspect. Because my understanding is the public sector membership in Netherlands is almost about 25 to 30%, if I'm not mistaken, even though the private sector is a little lower. So I mean,
yeah, so I don't think that we have information. So I would have to look at the data, but so I don't think that we have information on trade union membership. So we do have, so what you've seen, indeed, we have the sector of employment. So we could see what happens when we basically we look at separately at these public sector employees and non-public sector employees. This we can do, but trade union membership, I'm afraid that we don't have this information.
okay. I mean, I was just curious. So.
Yeah.
All right. Thank you so much, folks. I have to go teach now. All the best. Thank
Yeah,
you.
thank you so much. Thank you so much.
Bye now. Bye, everyone.
More questions? How is this? I mean, mental issues, burnout, and so on have become more accepted recently. Has this any kind of effect on your research? Is it dominant? I forgot. Is it dominant? Maybe I haven't seen it. Is it a dominant factor?
Yeah, it is. So it is. So if you look at here the statistics, so it is. So here, so if you see like psychological problems, so these are not mutually exclusive categories. So because you could have, both psychological. So maybe you have like a disease and then you have psychological problems, for example. But they are quite psychological problems are quite a large, one of the most important actually causes for sick leave.
Okay, thank you. Milena has a question.
Yeah, thank you, Klaus, and thanks, Viola. So maybe just one question about it's a clarification one about they were asked what kind of accommodations, if any, the employer has made, but were they given a time period when that would have happened, or in the past month, or is it in the past 9 months?
And in the past 9 months, I think. So it's not very specific, because also they could be 9 or more, but yeah.
Yeah, because I was thinking it might be that, when the employee is sick, already a couple of weeks after they become sick, they have to report to this company doctor and whatnot. And maybe at that point, very early on, they make these sorts of arrangements. And then, I'm wondering, if there is some sort of recall bias, although I doubt that somebody forgets about an arrangement with the employer, but it could be that they forget to mention it. I don't know.
Yeah, so the question is, what has your employer or employment agencies done to get you either back to work or to retain you at work since you reported sick? So it's really from the beginning.
Yeah.
It could be the only thing that, of course, at a certain point we do a diff in diff, right? So in a sense, there's no. So in general, yes, I understand what you mean.
Yeah.
But when you do the diff in diff, I do not expect that this is different, before or after
Yeah.
the reform, right? So that should be taken into account. But of course, when we just look at the data on accommodation, of course, could be.
Yeah. And then the comparison groups, do you do some sort of pre-processing, like some sort of matching or something like that to before you did the diff in diff, or is it just as is, so to say?
Yeah, we do as is. So we look a little bit, of course, the characteristics before and after, but
Yeah.
the match.
Marina, please ask a question. You have to unmute. Perfect.
Yes, hello. So first of all, very interesting presentation. Thank you. And my question is in this process, is there a medical figure, like an occupational physician that maybe evaluates the condition of the worker, his work capacity, and maybe in order to understand if the worker can sustain actually accommodations or not? Because maybe all these people are just too sick to be accommodated in the first place, and so it's not really in the hands of the employer, the choice.
Yeah, thank you. Yes. So there is, of course, an occupational doctor, but that sees the employees and the occupational doctors also determines how much the employee can work. But this is typically also together with sometimes it is also together with the employer also determining the type of task. So it should there is an occupational doctor that establish the type of disability and how much the employee can work, but sometimes there is also some input for the employer on what the employer is doing. But yes, of course, it can be, like that. So it's not that everybody has to go back to work. So that's not the, it could be that in some cases, indeed, you cannot go back to work. So that's right. But in principle, you have this period of 2 years to stay back. So not everybody has to go back to work, and also depends, of course, on the type of job that you're doing. In some cases, it's, for example, so if you have a physical condition and there's very physical type of job, of course, this is maybe difficult. But it is also true, but the other way around is also true. So it is also not true that every person who has some kind of condition that determines sick leave is not, really cannot work, right? So I think in the end, the inclusion also of these people in the workforce, it's important. So there has to be a balance between not, of course, the aim is not to force people to work who are very sick and are not able to work. So that's not the aim. But there are also a lot of people that maybe with some change in task or some change in what on the workplace, it could actually have also like they could be back in the workforce, and that would be important for them.
No, yes, of course. It's just because, in my perspective, it shouldn't be the employer that decides to whom to give accommodation, but a more technical figures that know a bit the condition and the job market.
Yeah, no, you're right. So the technical person established the disability, but then like the type of work or what you can do, then that is so the medical doctor cannot say, now you employer have to provide this and this. So this does not happen in the system. But I see what you mean.
Okay, thank you.
No problem.
Okay, I think our time is up. If there is no pressing final question, I don't see it. Okay, thank you very much for joining us today. It was a very interesting seminar. Lots of people participating. So we are still working very well. Thank you for today. See you soon again.
Thank you so much.